For decades, there's been this group of antibiotics that doctors have seen as a total go-to. I mean, they've been used for everything from urinary tract infections to pneumonia. They're powerful, they're effective, and they are incredibly common. But a steady drumbeat of warnings from agencies all over the world is starting to tell a very different and, frankly, a much more serious story.
And this is where it gets real. This quote isn't some dusty old warning from the archives. This is from 2024. The UK's top drug safety agency just dropped this major restriction, basically pushing an entire class of drugs to the back of the line. They're saying these should only be a last resort. Now that is a huge red flag. So let's unpack what is going on here. So, first things first, we are not talking about some rare, obscure medication that only a few people ever take. This warning is for one of the most widely prescribed classes of antibiotics on the entire planet. And because of that, there's a really good chance that you or someone you know has taken one of these. Ever heard of Cipro? What about Levaquin or Avelox? These are the brand names you're most likely to recognize. They all belong to a class of drugs called fluoroquinolones. And the fact that they're so common is exactly why these new warnings are so important to understand. Okay, so what exactly are these drugs? How did something go from being a medical workhorse that doctors relied on for years to suddenly being a drug of last resort in many cases? So at their core, fluoroquinolones are what we call broad-spectrum antibiotics, and their power is really in how they work. Think about it like this. For bacteria to multiply and spread, they have to copy their DNA. These drugs get in there and just break the machinery that lets them do that. It's like throwing a wrench in the gears. If the bacteria can't copy themselves, the infection just stops dead in its tracks. And here it is. This is the chemical structure of ciprofloxacin, which you probably know as Cipro. Now, you don't need a PhD in chemistry to get the idea here. This specific arrangement of atoms is like a perfectly shaped key that's designed to fit right into the lock of that bacterial machinery we just talked about and jam it. The problem, and this is a leading theory for the side effects, is that our own cells have similar machinery, especially in our mitochondria, the little powerhouses in our cells. And sometimes this very powerful key can end up jamming the wrong lock. So why did they get so popular in the first place? Well, simply put, they were incredibly good at their job. They're broad spectrum, which means they can kill a whole bunch of different bacteria. They have fantastic oral bioavailability, meaning you can just take a pill, and it's often as good as getting an IV in the hospital. Plus, they're amazing at getting deep into body tissues to fight off all kinds of infections. But here's the thing, for all their power, the concerns that we're talking about today are not new. Not at all. There has been a long and growing trail of red flags from regulators for well over a decade now. This timeline really puts it all into perspective, doesn't it? It all started way back in 2008 when the US FDA slapped its most severe warning, a black box warning, on these drugs because of tendon damage. Then, jump to 2016, and the language gets even scarier, talking about disabling and potentially irreversible side effects. You can see Europe followed with its own major restrictions in 2019, which brings us right back to that UK warning from 2024 that we started with. It's been a slow-motion alarm bell, getting louder and louder. And if we rewind back to that first big warning in 2008, the FDA was already pointing out that the risk wasn't the same for everyone. They specifically flagged that the danger of a tendon rupture was much higher for people over 60, for patients who'd had a kidney, heart, or lung transplant, and for anyone who was also taking steroids. Now, these warnings aren't just based on a few isolated stories, they're based on data. So let's get into the numbers and see what the risk actually looks like. In 2022, a study published in Frontiers in Pharmacology really dug into this. Researchers did some serious drug safety detective work. They went through the FDA's own database of adverse event reports and analyzed over 35,000 reports tied to these drugs, all to look for patterns. And what they found? Well, it's pretty eye-opening. One of the most interesting things they found is that not all drugs in this class are created equal. Ciprofloxacin, or Cipro, had the strongest link to tendinitis. That's when the tendon gets inflamed. But another one, levofloxacin, or Levaquin, showed the strongest signal for an actual tendon rupture. So the specific drug you're prescribed really does matter. And you're probably wondering, how quickly can these problems pop up? Well, the study found that the median time for tendon issues to appear after starting either Cipro or Levaquin was just 3 days. 3. This isn't some long-term wear and tear thing. It can happen, and happen fast. And check this out. Here's another surprising twist from that study. The data actually showed a stronger link to tendon damage when people took the drug as a pill compared to getting it through an IV. You'd almost think the opposite, right? But the point is, just because you're taking a simple pill at home doesn't mean the risk is any lower. The data suggests it might even be higher. And we have to be clear, we're not talking about minor aches and pains here. When you look at the outcomes that were reported for tendinitis, over half of the cases linked to ciprofloxacin resulted in a reported disability. That is a staggering number, and it just shows you the potential for serious life-altering consequences. Okay, so after hearing all of that, what does it actually mean for you as a patient? Let's break down the practical, need-to-know information. Health regulators are very, very clear about the warning signs to watch for. The most well-known one is pain or swelling in a tendon, especially that big one at the back of your ankle, the Achilles tendon. But it goes so much further than that. It can be muscle pain, joint pain, weird nerve sensations like pins and needles, and even psychiatric stuff like depression, anxiety, or changes to your senses, your vision, taste, or smell. The advice from the experts at the FDA and other agencies is crystal clear and super direct. If you experience any of those symptoms, step 1 is simple. Stop taking the drug. Step 2, contact your doctor immediately to figure out a different treatment. And step 3, rest the painful area and do not exercise because you don't want to cause any more damage. And the reason they're so urgent about this is right here. The official warnings are blunt. These side effects are not always temporary. They can last for months, sometimes even years. They can be disabling. And in some cases, they can be completely irreversible. This is why it is so important to act on those early symptoms. So look, the point of all this isn't to scare anyone. It's about awareness. The whole story of fluoroquinolones is this powerful reminder that every single medicine out there has risks, and our understanding of those risks can and does change over time. It really leaves us with a question we should probably all be asking every single time we're handed a prescription. Do we really know the risks of what we're about to take?